Welcome, everyone, to day 28 of Thriving in the Face of Cancer. I'm your host, Chef AJ, and every day for 3 more days, I will be talking to top doctors and other healthcare professionals, as well as people who have survived cancer, who will be giving you insights on how you too can thrive even in the face of cancer. My guest today is Dr. Michelle Loy, who will discuss integrative medicine approaches for living well with cancer. Please welcome her to the show. It's nice to meet you, Dr. Loy.
Thank you so much for having me, Chef AJ.
It's my pleasure. I know you have a wonderful slide presentation prepared, but before you get started, maybe you could just tell the viewers a little bit about yourself, what you do, and when you became plant-based.
Yeah, so I am an integrated medicine specialist, a medical doctor, MD. I practice at Weill Cornell Medicine, New York-Presbyterian, New York City. And I see patients of all ages for integrative medicine consultations. Um, I do see a lot of patients with oncology, and that's what I'm going to be speaking about today. But in all of my patient care, one of the main pillars that we always discuss is food as medicine and nutrition. And so I love talking about plant-forward eating and the benefits to health.
Wow. When did you become plant-based yourself?
I was pretty plant-forward all my life, but much more plant-based starting around 2016.
Fantastic.
Yeah. So if it's okay, I'll jump in. That
That'd be
sounds
great. Thank you.
so today I'm going to speak about from evidence to wellness, integrative medicine approaches for living well with cancer. So let me first start with a definition. What is integrative medicine? This is a question we often get. How is it different from complementary medicine? How is it different from alternative medicine? So complementary therapies are evidence-based healthcare approaches that are developed outside of conventional Western medicine that are used in conjunction with conventional care. Whereas alternative therapies are non-evidence-based, non-allopathic therapies used in place of conventional care. So integrative medicine, I like to think of it as blending the best of evidence, allopathic evidence-based approaches with other evidence-based approaches that have been used traditionally. And there is the National Center for Complementary Integrative Health, which is the NIH arm for integrative medicine that has a lot of research and educational aspects to integrative medicine. So the integrative medicine is defined by the American Board of Integrative Medicine that I'm a part of, and the Consortium of Academic Health Centers, which I'm also part of. And it really is the practice of medicine that, really reaffirms the importance of the relationship between the practitioner and the patient. So the practitioner and patient relationship is key. We focus on the whole person, it's evidence-based, and makes use of all appropriate therapeutic approaches. We're very team-based, and we use all the different disciplines that are available to us to achieve optimal health and healing. And so integrative oncology is basically integrative medicine applied to cancer care. And so we use, again, evidence-based complementary therapies in addition to the conventional cancer care. And this can encompass a lot of different areas, from nutrition to mind-body practices to natural products, of course, lifestyle pillars. So I practice both lifestyle medicine and integrative medicine. And this is used to help support patients as they go through treatment and even after treatment. And as I mentioned, the NCCIH, actually now there's a push toward perhaps changing the definition of integrative medicine to whole person health, because really it's not just nutrition and physical activity and mind-body stress reduction, but sleep and our health beliefs and values. Later, I'm going to talk about the importance of mindset, very important. Spirituality, meaning and purpose, right? Very, very important. I know Chef AJ with your all the different F's, right? Faith, right? Food, substance use, our neighborhood, our built environment, healthcare access, education, personal development, academics, economic stability, social determinants of health, and the role of family and social community. We're going to talk about that as well. Our group visits. These are all very, very important when we're talking about health and healing. And this is just another overview showing all the different areas that integrative health or whole person health covers, from natural products, medicinal plants. I get a lot of questions about herbs, botanical supplements, what's evidence-based, what does the research support? We talk about, of course, diet all the time. In all of my consultations, we talk about herbs and spices and, what can we do from a nutrition perspective? Prebiotics, probiotics, the microbiome is big right now. Vitamins, dietary supplements. What is the role of those? Is there a role as we're going through treatment? And of course, all the psychological mind-body practices, mindfulness-based stress reduction, psychotherapy. Even the role of mindful eating comes up as, as we go through treatment. What is our relationship with food, right? All of that's very important. Of course, there's a lot of data, emerging data on yoga and Tai Chi and Qigong, and I will touch some of that later, and art and music and dance, meditation, and of course, manual therapies, hot, cold, acupuncture is a big one. I'm on board sort of in acupuncture, and that's something we use a lot. Very, very helpful going through treatment. And there's, other areas as well, including surgery, medication. This is the kind of the big toolbox we pull from. Now, I want to emphasize that the Society for Integrative Oncology, which I'm also part of, they developed some clinical practice guidelines, which they summarize all the available evidence for clinicians based on the evidence on what would be helpful during and after various types of cancer treatment. And what's really important was these clinical practice guidelines were actually adopted by ASCO, which is the American Society for Clinical Oncology. It's the biggest standard, biggest organization for cancer clinicians. And again, these clinical practice guidelines, I'll show you some of the other ones later on, include, again, physical, mind, body, and social. This slide just shows you that everything is very rigorously based on evidence. So grade A means that there is high certainty that the benefit is substantial, so that we should provide this modality, whereas I would show insufficient evidence. And if it's an H, there's moderate or high certainty that the harms outweigh the benefits, so we would discourage the use of this modality. So when you see in the subsequent slides the different grades, this is just to show you it's based on weighing, looking at the evidence that's out there. So for example, this is a busy slide, but the main point is these different symptoms or side effects that are common, whether it's like lymphedema or neuropathy, like nerve pain or general pain or quality of life or sleep disturbance or hot flashes. These are common symptoms and side effects that patients come to us for. So then you can see, well, based on these recommendations, which modalities have the most evidence. So you can see here are some ABCs, like meditation, very, very high on the list for improving quality of life. Yoga, same thing. Acupuncture, mistletoe, qigong, reflexology. This is a grade C, stress management, right? For sleep disturbance, yoga and acupuncture. So there are a lot of different modalities that we can consider. Again, for mood disturbance or depression, meditation is up there. A lot of the mind-body practices are very high up there. Most of them have A's. And then you have some other, music therapy and massage and acupuncture. These can be very helpful as well. Hypnosis. However, there are some things that are not recommended, at least, don't seem to work so well for fatigue or have negative effects. So here are some as well. They came out with ASCO guidelines in 2022 for pain. So sometimes this is very common, joint-related pain from, for example, aromatase inhibitors, or just general cancer pain, or another very, very common symptom is chemotherapy-induced peripheral neuropathy. And so, or procedural pain or surgical pain. So these are all the different therapies, as you can see here, and the quality of evidence and the strength of recommendation. We have similar guidelines for, went ahead, for anxiety and depression. Again, you see very similar, a lot of mind-body interventions, yoga, acupuncture, music. This comes up a lot. And then for fatigue. And I'm going to use fatigue as a sort of an example to kind of show you what we do in our practice, what I do in my practice. But again, exercise is a big one. A combination of aerobic resistance and a combination, lots of data on that. Cognitive behavioral therapy, again, mindfulness-based programs, Tai Chi, Qigong, psychoeducation, possibly American ginseng. So that's during active treatment. Then after active treatment, we have some other modalities considered, then post-treatment. But then there are interventions that should not be recommended, and these are here as well. So the point is there are definite guidelines that are based on the evidence that's what we have so far, and these are guidelines that clinicians can follow. And not just in America, but the European Society for Medical Oncology also has clinical practice guidelines, very similar. I just showed you this paper on cancer-related fatigue, but again, very, very similar modalities. And I really love this paper by Dr. Mao and his colleagues looking at the National Comprehensive Cancer Network clinical practice guidelines. Again, the NCCN is a very, very big network, pretty much, any kind of oncology diagnosis, they will follow their guidelines. And this was the clinical practice guidelines for the use of integrative medicine for supporting cancer care. So if you look here, yoga almost clicks almost all the boxes here. Meditation, acupuncture, exercise is big. Nutrition is very helpful for fatigue, anxiety, of course, anorexia, and music therapy you see here. So it kind of shows you where the evidence is for the modality and what you're facing, what symptoms you have. And then in our state, in New York State, in 2022, there was a law where practitioners had to consider and prescribe non-opioid treatment alternatives for treatment of neuromuscular skeletal conditions. And this is good because acupuncture is under that as well. And with changes in these laws, hopefully there'll be more and more insurance coverage. And now that more and more there are, for example, Medicare often will cover acupuncture for lower back pain. And so there's more and more, as the evidence accrues, there's more and more potential for insurance coverage for these modalities. Cancer misinformation, social media. Social media can be wonderful, as you can see with all of the wonderful work that Chef AJ has done in this space. But the social media can be problematic at times. So it's very important that we know where we get our information from. And, we get a lot of our healthcare information often from online sources, but there was this one study on social media looking at 4 different types of cancer, and it showed that 1/3 of the articles were inaccurate, and more than 3/4 of them contained some harmful information, inaccurate information. So I think it's important that we make sure we get our, information from the right sources. There was a study done actually at our institution, a small study during the pandemic looking at a breast cancer survivorship clinic. And they looked at the reasons for vitamin supplement use in this cohort. And many reasons included recommendations, maybe by a physician or maybe by a friend. It was during the pandemic, so people were concerned about catching a cold or viruses or immunity or prevention of COVID. Some of them wanted to prevent bone loss. But what was most interesting about the study was 90% of these breast cancer survivors in the study were taking dietary supplements ranging from 1 to 9. A mean was about 2, 2.5 for a variety of reasons, but none of them had an accurate list in the electronic medical record. Oftentimes because patients either don't feel comfortable talking to their medical provider about it for whatever reason. And so whenever I talk to my patients and when I lecture to medical students and the residents and they give CME talks, I encourage both patients and providers. Patients must disclose, you should tell your healthcare team what you're taking, everything, medications, including vitamins, supplements, all of that, because they can interact. It's very important that we know. And then I tell my medical students and residents, always ask about vitamin and supplement use with your patients. So in our integrative oncology consultation, we always start, I personally start with nutrition and diet, physical activity. I talk about sleep, stress management. I will review all the medications and herbs and supplements. Oftentimes the oncologists refer patients to us to advise on this and whether it's safe or not, or whether there's herb-drug interaction. And then I spend the rest of the time talking about what are the symptoms that the patient is facing and which integrative modalities might be the best to consider. So again, common symptoms we've talked about include pain, fatigue, insomnia, anxiety, nausea, vomiting is a big one, neuropathy, dry mouth, hot flashes. I love this quote from John F. Kennedy, this word for crisis in Chinese, and it really talks about how in the face of adversity, there is the opportunity. There's always the opportunity. So if I'm lucky enough to see a patient or get the patient referred to me before surgery, if that's in their the plan, we like to do the Prepare for Surgery program, which is a guided imagery program that is really helpful for pain, anxiety, insomnia, and even for some of our patients that go through chemo. There's actually some studies, it's Peggy Huddlestein's work at different hospitals where they've shown that there's been shorter hospitalizations, less need for opioid, less blood loss, and it's through this guided meditation program. And in the protocol, they actually have some statements that the patient can give to like the anesthesiologist to read as they're going under anesthesia. So it's a very prescribed program that is very helpful. Before surgery is, if I'm again lucky enough to see them, it's a good time to remind patients to stop certain herbs and supplements, discuss any herb and drug interactions. Almost all of them should be stopped usually because many of them can interfere with, platelets and bleeding. Proper nutrition is big, getting enough adequate protein, especially plant protein, in my opinion, avoiding sarcopenia. Talking about anti-inflammatory diet. I speak about a plant-forward anti-inflammatory diet, throughout whenever I see the patients, because there's a lot of data on the benefits of that. An immune-supporting diet. We talk about physical activity. We may talk about acupuncture, either to help with sleep or anxiety. And then this is a great time to talk about social connection, family support groups, and the role of group visits, which I will tell you about a little bit later that I started at our institution. I already mentioned the pre-surgical nutrition, important to make sure albumin is adequate, that vitamin D levels are good, that there is the anemia is, there is an anemia, and that there's not any malnourishment. And it's not just a matter of weight, it's a matter of nourishment. Gut diversity, I love talking about the microbiome, probiotic rich foods, fiber intake. I talk about fiber all the time. Our country does not really have a protein problem at all. Most people get more than enough protein if they're getting enough calories, but we do have a problem with fiber intake. And later on, I will talk about actually the role of fiber as we are, some patients are on these cutting edge immunotherapies that some of them can have, in certain cases, have gone from stage 4 to completely no evidence of disease. But there's some studies showing that fiber intake actually improves the disease-free survival and the response to immunotherapy. So here's a perfect example of the best of both worlds, the best of cutting-edge medicine and the best in combination with time-tested modalities, including nutrition. Talk about fermented foods, glycemic control, protein, adequate fluid intake, and then I answer questions about different supplements. And then here's a very short list, but things like garlic or ginkgo, St. John's wort, kava kava, ginseng, these are should be stopped before surgery. And I often get questions about like curcumin and various medications. For example, we usually do not recommend any curcumin supplements when a patient is on tamoxifen, but if they're on an aromatase inhibitor, that would be okay. So these are kind of nuances that really you should speak with an integrative physician if you can. This is the Prepare for Surgery, Heal Faster program that I mentioned. That is very helpful for decreasing anxiety. And again, shown to also result in less pain medication, faster healing. It's a really good program as well. And we can use it for some of my patients I've had, need an MRI, but they don't want to use sedation for their anxiety. So this can be very helpful, guided imagery for that. And even visualization before going through or while going through chemotherapy can be very helpful as well. And even radiation, some of our patients, if they, to help with their anxiety as they're getting that. There are other guided imagery resources. Bella Neprasak has a really great one through Kaiser. There are different, CDs and that you can listen to, and that can be very helpful as well. Around if there's operation or surgery, we talk about different wearing compression socks, and eye masks and earbuds and things like that. Stopping tobacco, cannabis, alcohol, and various books that are really great. One is by Dr. Lorenzo Cohen. He's a researcher in integrative medicine at MD Anderson, and he himself is a cancer survivor, and he wrote a very good book called Anti-Cancer Living. And there's another one as well by David Schreiber. After surgery, we often talk about the use of acupuncture for helping, again, with wound healing, immune system, sleep, anxiety, depression. These are some of the reasons why we might use it. Once patients are clear for physical activity, yoga is very, very helpful. There's quite a bit of evidence for yoga in cancer. We talk, again, always about proper nutrition. Often I'll answer a lot of questions and myths about different fad diets and questions about soy, for example, which is beneficial. Whole soy, I'm not talking about soy supplements, but whole soy in its whole form, like edamame, tempeh, tofu, soy milk, soy nuts. Talk about the microbiome, again, always trying to optimize the microbiome. And then things like, again, guided imagery for either, chemo preparation, insomnia, or fatigue. Then during adjuvant therapy, whether it's chemo, radiation, or endocrine therapy, immunotherapy, again, the role of the microbiome, nutrition, addressing various symptoms, we always say that there are many tools in the toolbox in integrative medicine that can help support our patients to get through, to adhere to the treatment that their oncologist has prescribed for them to be the best for their particular situation. And that's why we get a lot of referrals from the various oncologists, whether medical or radiation oncologists or their surgeons, because then we can help support patients through to their treatment. And then post-treatment, I see a lot of patients, thrivers after cancer. So here's an excellent time to reinforce nutrition, plant-based, anti-inflammatory whole foods, minimizing dairy, sugar, refined carbohydrates, red meat, eggs, things like that. Discussing physical activity. I spend a lot of time talking about the benefits of physical activity. As much as I love talking about food as medicine and the benefits and the evidence behind food as medicine, the amount of data we have for physical activity is even more. And there are lovely, wonderful programs throughout Live Strong, many other programs that are available, from aerobic to resistance to yoga, Tai Chi. There are even, I know there are retreats that do fly fishing. So there's a lot of different options for physical activity. Actually, once you're part of this oncology club, there are a lot of different retreats for different age groups and different types of cancer that you are eligible for. Often many of them are at no cost. And a lot of them involve, nutrition, physical activity, and stress reduction. So I encourage you to look into those. And I usually will refer many of my patients to those as well. Traditional Chinese medicine, acupuncture, we'll use that sometimes in our practice, including and also Ayurvedic medicine. These can be very helpful for, especially after treatment, for fatigue and mood and sleep issues. We may use biofeedback for stress reduction. Again, I already mentioned the mindfulness-based stress reduction, the guided imagery, this is to remind me to tell you about Casting for Recovery. That's the fly fishing meditative weekend that is free for cancer patients. And then the role of group visits. So this is something I started at our institution. These are shared medical appointments, group visits, a series of 7 sessions talking about all the different areas of integrative oncology. About, I think, 3 or 4 of our sessions talk about food as medicine. One is on physical activity. One is on, actually today we have one on narrative medicine. We have one on yoga, qigong, one on herbs and botanicals and supplements, and one on culinary medicine. So a lot of different topics that we cover in a group setting. Watching the time. And these group visits are very helpful because not only can we discuss, educational, give the evidence-based education, but it's a great opportunity to connect with others who are going through the same experience. And so I love this proverb, African proverb: if you want to go fast, go alone. If you want to go far, go together. And this is an old study from 1989, but I think it was done at Stanford, Dr. Spiegel, but it showed that support groups double the survival rate in this group of metastatic breast cancer patients. And in more recent years, we have more studies showing the benefits of social networks and social connection and relationships, even as it affects mortality after, in this case, a breast cancer diagnosis. This is the so-called LACE study, Life After Breast Cancer Epidemiologic Study, done in 2013. And, it didn't matter if it was a big or small social network, it was beneficial for survival. And then there are a number of other studies that that look at the benefits of social connection, and on the flip side, the risk of social isolation. Really, really important. And there was one study looking at social isolation being as much of a risk factor as high blood pressure, obesity, lack of exercise, or smoking. And there was one study I saw even. I mean, we would never recommend that we get together and have a support group, cancer support group, and smoke together. But in this study, it showed that even those who smoked together, or not related to cancer, but smoked, or alcohol, they still were better. They were healthier. Well, their mortality was not as high, and they attribute that to the social solidarity. Although, of course, what we want to do is all of it. Avoid the, minimize alcohol and tobacco, and have social connections that are positive around health benefits. And we see this with the blue zones as well, where oftentimes we think it's all about the food, but if you look at the blue zones, the commonalities of these places in the world where there's longevity and vitality, 7 out of the 9 factors are not related to what's on the plate. It's the social connection, it's the purpose, it's the knowing how to downshift, right? A lot of them have, whether it's faith or, some groups, they take naps, they downshift, they have ancestor worship. So there are a lot of differences both in their actual diets and what they eat, but there are some commonalities. And the commonalities again are that they're plant forward, they have a lot of social connection, they have a sense of purpose, they know how to downshift. But I think a big one is their social connection, right? And another thing is that a lot of their, I would say their lifestyle pillars are around health, as are their social groups. And so that's why I think what Chef AJ has been doing in bringing this community together is really, really wonderful. There's another study looking at breast cancer and social environment, and again, showing that the benefits of social connection. And here on the right, showing how social connection potentially, is beneficial, and how it affects, or in this case, social isolation affects cancer. And then the idea of resilience, and I think this is very, very important. Later on, I'll talk a little bit more about mindset, which is super important. But again, finding the opportunity within the crisis of cancer, taking back control, and avoiding guilt or self-blame, or things, recognizing that we can't control everything. I think that's very, very important. And it's nothing that anyone did for cancer to happen. It just did. And a lot of different reasons why, but trying to find the reason often is not very helpful. Joy of living is the most sustainable motivation. And again, this is something that we see in the blue zones as well, having, they call it a plan de vida, or a kige, or, different, the different cultures have different names for it, but the commonality is having that sense of purpose. Cognitive behavioral therapy, turning negative self-talk. It's very important because we are reprogramming our the connections in our brain, right? And so we're all going to have fall off the bandwagon, or fall back on it, right? And we're in January right now, right? But reframing it, instead of saying I didn't walk yesterday, well, I gave my body the rest, right? Instead of saying, oh, I ate a slice of cake, okay, I enjoyed that slice of cake with my loved ones and savored each bite. So it's very important to cognitive behavioral therapy is very, very important as well. The NCCN nutrition, they have wonderful guidelines. Again, they're even here, they say they encourage a diet that's at least 50% plant-based. Again, the point is lots of vegetables, fruits, whole grains, nuts, seeds, legumes, limiting red meat intake, limiting refined sugar, limiting alcohol. These are, I think, you all are very familiar with this. But the survivorship care for healthy living is a very, very good set of guidelines from the NCCN. Again, water, lots of water, plenty of fruits and vegetables, whole grains, and protein. Okay. I often talk a lot about so-called anti-cancer superfoods, and I don't like to focus on the so-called superfoods, because pretty much any plant food, any spice, any herb is a superfood. But of course, we like to talk a lot about mushrooms, not just Asian mushrooms, all mushrooms, berries. Actually, I have a whole half one of my group visit sessions, half the sessions is all about mushrooms. Berries, cruciferous vegetables, love to talk about cruciferous vegetables. If you have to pick one category of vegetables to emphasize for cancer fighting, it would be cruciferous vegetables for sure. And so we're talking about kale, cauliflower, right? Bok choy, arugula, kohlrabi, things like that. Broccoli sprouts. Flax seeds are great. Chia seeds, pepitos, pumpkin seeds, green tea. And then I don't have here, but the allium family, onion, garlic, that whole family is very, very good of plants, very, very good. And then we like to talk about using your fork and feet, right? Number of studies looking at lifestyle changes being helpful for delaying treatment for early stage prostate cancer. We have studies in breast cancer, and it's pretty clear. 5+ servings of fruits and vegetables daily, 150 minutes of moderate exercise per week, very, very helpful. And reducing risk for mortality and even overall risk reduction, regardless of weight, independent of weight, actually. I love this study on sofrito. This was looking at Puerto Rican women that they looked at their intake of onion and garlic, and which is a sofrito, right? Sofrito is usually, the way I make it, usually bell pepper, onion, garlic, and some spices as well. And that reduced the risk of breast cancer. Actually, those who consume sofrito, which you put in rice and beans, right, more than once a day, had a 67% decrease in risk. And compared to women who never ate that. That was in one of the studies. And there are studies in other countries like France, Mexico, Taiwan, and China that also show a benefit to onion and garlic intake and breast cancer. They didn't see that in the studies, though, in the Netherlands and Italy. Microbiome cancer, a lot of more studies coming out in this area. I've seen one, of course, at MD Anderson, they have one looking at melanoma, and this was the one I was telling you about, fiber intake being increasing disease-free survival and also response to the immunotherapy. And here, this was a study looking at cervical cancer, patients with cervical cancer getting chemo radiation, and how the gut microbiome diversity was an independent predictor of survival. And so this is why I talk about the microbiome with my patients a lot. And the best way to have, as far as what we know so far with the research, is that to get a healthy microbiome, the best way is to eat a diverse number of plant foods. Pretty much all the researchers agree on that. Now, whether or not probiotic supplements, the role of that has not, that we still don't really, the research is still emerging with that. This is that study at MD Anderson that I really, really like, showing a high fiber diet, and it was not seen with probiotics, but with a high fiber diet, meaning, plant forward diet, rich in fiber, that these advanced melanoma patients that were on these immune checkpoint blockers who had just at least 20 grams a day of dietary fiber, which is that much, they had the highest disease-free survival. And each 5-gram increase in the daily dietary fiber corresponded to 30% less risk of progression of the disease. So this is where we can get the medication, the best medication, best therapy, and use nutrition for the best outcome. And then, maximizing whole foods. I know this audience is familiar with this, and minimizing ultra-processed foods. So, people know chips, soda, hot dogs, ice cream, frozen meals. Those are obvious to people, but a lot of, ramen, potato chips. A lot of times people don't realize that gluten-free cereal bars or protein bars or some of the protein powders or yogurt, these kinds of, or even like vitamin waters, you have to be careful, because if they're, if there's a label with a lot of marketing on it, then look at the label again and make sure it's not ultra processed, because blueberries and nuts and avocados, they don't need labels. They just have like a PLU maybe, but they don't need marketing around them. They just are. And this was a study that a lot of my patients asked me about when it came out, looking at ultra-processed foods and cancer risk and cancer mortality. This was a very, very large study. And it did show that ultra-processed food consumption was associated with increased cancer risk and cancer mortality in a number of different types of cancer. I love Dr. Greger's Daily Dozen. I'm sure you're all familiar with that, but these are all very beneficial. I encourage patients to put it on their refrigerator. Now I guess they have an app now. Okay, I got to move faster. A lot of great studies on physical activity.
That's okay. Don't rush. Please don't rush.
Okay, no, okay.
Yeah, please do not rush.
Okay. Physical activity. So I have probably 10, 15 slides that I could show you on physical activity, but I'm just going to show you a few here. But physical activity really is beneficial for survival, but it's also really, really helpful for all kinds of symptoms, including chemo brain or brain fog. And I will mention chemo brain. Cancer patients don't have to have chemo brain. It's just kind of a brain fog that often happens. And regular exercise is so helpful for preventing that. And also it helps with improving cognitive function after even 6 months after chemotherapy. Physical activity is associated with reduced risk for 13 types of cancer recurrence and mortality. And, I like to talk about how, for example, for chemo brain, this particular symptom, there's really no good medication to approve to treat it. Sometimes physicians will prescribe like a stimulant like Ritalin or something just to help with the symptoms. But, there are other things like cognitive exercises, mind-body stress reduction, and I would say physical activity, especially resistance training. And it can be body weight exercises that is very helpful for chemo brain. And probably the reason for that is I always tell my patients, strong muscles means strong brain. When we build muscle, we get higher levels of what we call BDNF, brain-derived neurotrophic factor, which is like miracle growth for the brain. And so whether it's chemo brain or even like, cognitive decline from, Alzheimer's, dementia, or things like that, I always encourage patients to include some resistance training as much as possible. And that's, good for preventing, loss of muscle and also helpful for bone health, which for cancer patients is something that we do need to focus on as well. Exercise improves treatment effects. So it limits the toxicity and late effects of treatment. So again, there's just so many studies looking at, for example, yoga helping with fatigue, weight training for lymphedema, as well as lymphedema massage, right? Exercise, quite a bit of data. Dawn Hirschman at Columbia, she's done a number of studies on exercise and acupuncture on aromatase inhibitor-induced arthralgias. I already mentioned the cancer-related cognitive dysfunction, exercise helping that. Resistance training is helpful for fatigue. We know that, whether people are on chemo or radiation. And of course, it helps with reducing fat tissue, adipose tissue, which is important, right, for survival. And this is really important that even we call this NEAT, or even during non-exercise times, breaking up prolonged sitting activities is very important. And there are some studies, there was a study, I guess last year or year before, looking at just doing calf raises, like when you're seated at your desk, let's say you're working, and that being helpful in strengthening the soleus muscle, that calf muscle, and helping with actually reducing the glucose level. And there was also another study looking at just 10 sit to stand transitions per day, helping with insulin resistance, which is important for especially for certain types of cancer, like hormone-related cancers. So the point is, throughout the day, getting a little bit of exercise. Like it can be 5 minutes, like, here and there. And oftentimes I'll tell patients, another good reason for like having a water bottle, drinking water throughout the days, it will force you to have to, like, especially if you have a sedentary job, or, I'm seeing patients and I'm sitting, it forces me to have to go to use the bathroom. So at least I have to go and walk and break up the, sedentary activity. Actually, yeah, I saw a recent study where they had people, I think it was like 5 or 10 minutes, 5 minutes maybe, or 5, 10 minutes every hour. And they compared that to like a continuous exercise, because, and how it was actually more beneficial than like doing all your like marathon training in the morning and then just like laying on the couch the rest of the day. Exercise reducing recurrence. There are a lot of studies showing that. And even if people were not active before diagnosis, it was beneficial. Now, of course, if people are active before diagnosis, that's the best. But if they increase physical activity after diagnosis, they had a 45% lower risk of death. So that's really important. Now, a lot of these studies, if you look at them, they're kind of hard to understand. They use MET hours. That's just the way they do it. But in this nurses' health study, 9 MET hours a week is basically 3 hours a week of like mild to moderate walking. So that's not really that much. And that reduced by half, in this case, the breast cancer recurrence, the breast cancer specific mortality and all-cause mortality, even 2 years after diagnosis. This is just one study to show how beneficial exercise is. And there are many others as well. This other one, this 2008 study, 5 years post-diagnosis, if they were exercising at least 2.8 MET hours a week at moderate intensity. So that's really, again, 3 hours at moderate intensity. Again, very beneficial for a reduction in mortality. In this particular study, it was longer duration, but not increased intensity, increased the benefit of exercise. But I've seen studies showing both, so I wouldn't worry about either. Just, even a short period of time is better than nothing. And there are some studies looking at Qigong and Tai Chi and cancer symptoms. We have started a Qigong group visit at our center, which has been very helpful for our patients, especially for fatigue and sleep and general quality of life. Baduan Jin is a particular type of health-related exercise. I'm quoting John O'Kennedy a lot today, but this is physical fitness is very, very helpful for physical health. But I also think, as we know, it's very helpful for mental, emotional, and very, very good for creative and intellectual activity. And I think we all know that after physical activity, I know that for me, when my runs are when I'm the most creative and most sometimes some of the ideas that I get come during that time. Mindful movement. Again, I have a whole session on yoga, but there is a lot of data on yoga being very helpful for cancer. Again, I would say in my experience, very helpful for joint pain, or neuropathy, good for fatigue, good for musculoskeletal aches. What else? Anxiety, depression, sleep, all of that, fatigue. So now for the next few slides, I'm just going to show you how I use the different tools in the toolbox to address, for example, fatigue. So this is just one study I pulled looking at patients that they were on standard of care, chemo and radiation, and they also took some Mariva, which is it's curcumin, turmeric, and this was associated with improved fatigue, cognitive function, less nausea and vomiting. And in this case, these patients, they did not want to lose weight, and this helped with that as well. So here they were on standard of care, plus they were able to take some curcumin, which was helpful for them. This is a slide that this is a study that I often quote. This is the main study I think that people use to support the use of yuanzi or turkey tail or Coriolis for cancer. And they looked at 5 different types of cancer, including lung, esophageal, colorectal, gastric, and breast. Chemo alone and chemo with PSK. PSK is it's an extract from yuanzi or Coriolis or turkey tail. There's also PSP, depending, it's either Japan or China. And when they looked at that, the combination of chemo and this extract, it just showed improved survival times. And so this is what this study is often, I think, quoted. Also helps with decreased fatigue. And there are other mushrooms that I use also, including linzhi or Ganoderma reishi, which has been, I think it's called the mushroom for immortality, but it's been used for many thousands of years in traditional Chinese medicine, but it's very helpful for fatigue in general as well. And so for cancer patients, this is also helpful. So for fatigue, cancer-related fatigue, we talk about diet, exercise, yoga, for example, correcting any kind of sleep disturbance. If patients are done with therapy, then we can consider using certain herbs or supplements potentially, and medicinal mushrooms. And then as far as sleep, of course, we talk a lot about sleep hygiene, minimizing alcohol. We'll talk about cognitive behavioral therapy, meditation, and there are even some patent formulas that we may use from traditional Chinese medicine can be helpful. Mostly they're food-based. I may use nervines sometimes. So these are plants that are helpful for stress or sleep. Like milky oats is a great one. Lemon balm, chamomile tea is also very helpful. Sometimes we'll use lavender as well. And then for like joint pain, again, acupuncture is a big one. Certain vitamins sometimes we'll discuss depending on what else the patient is on. Exercise is a big one. I use acupuncture a lot in my practice. We have 5 acupuncturists at our center, and so we find to be very, very helpful as patients are going through treatment for a number of, whether it's nausea or joint pain or muscle pain or sleep issues or anxiety, all very, very helpful. Lots of studies on that. This is, we all know this, Dr. Barnard's study with Hanako Aliova on soybeans and whole food plant-based diet. And I use this again for patients who are dealing with hot flashes. Sometimes when they go through treatment, they go through hot flashes. And so if they add some organic soy, it can be very, very helpful, along with acupuncture. Okay, I want to leave a little time for a few questions. Plants, so even actually a lot of our chemotherapeutic agents and either other medications, like metformins, like diabetic medication, come from plants. Many people do not realize that. Both etoposide and vincristine, these are both chemotherapeutic agents that are used. They come from the May apple and the Madagascar periwinkle. So I always like to let patients know that plants are a big source of our helpful medications, but we can also use plants for symptoms as well. So I use ginger a lot for nausea during chemo. After, as they're going through, actually any type of nausea, it's helpful for motion sickness. It's helpful for even related to morning sickness and pregnancy. Acupuncture on this Naguan point, pericardium 6 is very helpful. And you can even do like a self-massage on that point for nausea. And then constipation, there are a number of things we can use. Mazi Renwen is a hemp seed traditional Chinese formula. We actually use it. We use it. Sometimes I use it for my patients in my practice, and I know it's like at Sloan Kettering, they have it on their formulary for certain patients. So there are a lot of things, a lot of plant foods that can be used for symptom relief as well. For diarrhea, sometimes I will use certain types of probiotics, marshmallow root powder. Actually, that's a very good demulcent for not just irritation on in the anal area, but any type of demulcents can be used for really any part of the body is what I'm saying. Yesterday I used it for I was recommending it for one of my patients with a little bit of mild GERD. So, anything that it's a very healing type of plant. I love the study on kiwi. Now it's not a couple years old now, looking at constipation, not specific to cancer, but they looked at kiwi, prunes, and psyllium, and they were all equally effective, but kiwi was the most well received by patients, and it also had the additional benefit of improving bloating and had the least adverse effects. So often I will use this opportunity to tell patients to enjoy their kiwi. And then I love talking about herbs and spices. I have a whole presentation on that, probably an hour long. And I'll just tell patients what is your favorite spice, and then talk about the health benefits. But specific for cancer, garlic is very, very good. Ginger, I mean, turmeric, we talked about it already. Parsley, I mean, any spice, oregano, rosemary, basil, these are all very, very good. And then this is a short list of, I just wrote down what some of the herbs and spices that I'll use in when I talk to patients. So whether it's gastrointestinal, or gassiness, or poor appetite, or poor digestion, or anxiety, I will, use these different types of, basically plants, and encourage them to include it in either tea form or in their food. One really great Ayurvedic tea I often recommend is, if people have gassiness, is called CCFT, cumin, coriander, fennel. That's wonderful. And when you go to an Indian restaurant, they often have like a bowl, like next to the candy bowl, they have like fennel seeds, because they know it's very helpful. They've known this for thousands of years, how it's very helpful for digestion. And then, we have different medications we can prescribe, these swish and swallow mouthwashes that can be helpful when people go through radiation and chemotherapy. But there's also, you could make your own with, or I have a recipe for using chamomile and calendula and licorice, which also be very, very soothing. And again, I use culinary herbs and spices: ginger, garlic, fennel, basil, cinnamon, parsley. These are all really, really helpful. Teas I will talk to patients about, hibiscus tea, CCFT, chamomile, holy basil, dandelion tea. These are all really good teas as well. And I talk about how eating healthy can be, it's fun, it's delicious, makes you feel good, and very, very tasty. So here's examples of common foods on rotation in our home. And then, yes, we talk about limiting endocrine disruptors. So not just what we eat, but, trying to use glass rather than plastic, using a water filter, looking at the EWG has some very, very good resources, not just their clean, dirty dozen list, but also like a lot of the people ask about cosmetics. So they have a very good website where you can put in, like, what's a good sun blocker, or different type of personal care items. They will kind of rate those as well. And the best way to naturally detoxify is not to take some kind of binder, but to support your natural way of detoxification, eating lots of plant-forward foods, exercising, having good bowel movements, and sweating. So these are all ways to support our body, which knows how to detoxify itself. Peripheral. Okay, peripheral neuropathy. I think I had this in there from another talk, but again, acupuncture, yoga, very helpful for that. Chemotherapy during chemo. Are we still okay?
Yes, absolutely. Absolutely.
Okay. I think I'm almost done. During chemotherapy, people, sometimes I'll recommend certain teas. Throat ease. Actually, I recommend this for my patient yesterday with GERD, not cancer patient, but very, very helpful. Acupuncture. So a lot of these things are similar. There's different cookbooks that I'll recommend. Rebecca Katz has a great cookbook, One Bite at a Time, especially for people going through cancer treatment. Sometimes people will say, oh, what can I cook for my my loved one, she has some really good recipes there, some soups that are very, very good. And she has a broth that I often recommend, or I kind of will riff off of. But again, lots of mushrooms, onion, carrot, celery, whatever kind of vegetable you want. And then adding a little bit of protein, like lentils. And sometimes I'll add a little bit of astragalus as well. During radiation therapy, I like using the calendula as it's very, very soothing. Aloe is also helpful. Some people find that the green tea extract spray can be helpful. If it's in the pelvic area, sometimes people use topical lidocaine or topical boswellia, that's frankincense. And even cognitive behavioral therapy, there was a study looking at how it was helpful during breast radiation therapy. So again, there are many tools in the toolbox. Post-treatment, again, same kinds of things that we've talked about already. And this was the NCI study, National Cancer Institute study on hypnosis and aromatase inhibitor discomfort. So again, some people may want to do yoga, others may prefer to do hypnosis, other people may, prefer to do acupuncture. So, really depends on what works for you, what you would like to try first. Soy, I think we've talked about, you've had many people talk about this before, but I find every opportunity to talk about, the misunderstanding around soy. Soy is beneficial, and I do recommend it for my patients. It should be whole soy in the whole form, not soy protein isolates, not soy protein powders, but in whole food form. Okay, edamame, organic soy nuts, organic tofu, tempeh, organic soy milk. Oh boy. Okay, I have a whole group visit on medical cannabis, but mainly I'm just going to say the main point is we get a lot of referrals from the oncologists at our institution to give consultations about medical cannabis. The point is, I'll just tell you briefly, it is a plant, and so it has, everyone knows about THC and CBD. Those are the main cannabinoids, but there are many other cannabinoids as well. More research is being done on those as well. But just like any other plant, it has terpenes, it has carotenoids, it has fatty acid, it has steroids, it has vitamin E, triglyceride, and these are all potentially beneficial. And actually the terpenes of the cannabis are probably what are responsible for the different types of aromas. But what I want to say is these terpenes also are found in other plant foods like pine needles, lavender, black pepper, hops, and citrus. And so these particular terpenes may be responsible for some of the additional health benefits, right, that you can see with different forms. There are many different reasons why people use medical cannabis. In our practice, we find it to be very helpful for pain, for sleep, for stimulating appetite, for helping with nausea, and for mood-related things. In general, there's a wide margin of safety, and can be very helpful. So every state has their own law. So it depends on what state you're in, but in our state, we follow this, that we have a lot of different forms that are allowed. So we'll talk about, like, it depends on what kind of cancer they have. Like if they're lung cancer, they probably wouldn't use the vaping form, but there are many other options, like, under the tongue or, oral forms. I'm just going to skip through all this, but basically, in our experience with oncology patients, we talk about potential adverse effects, but we hardly ever see these types of side effects in these patients. There are definite contraindication and risks, which we talk about, which we need to weigh. But again, there are several studies showing that it is very helpful with quality of life. This was done in patients with brain cancer, and it was shown to be helpful for the quality of life, safe with no serious adverse effects. Another study done in Israel, I believe, in cancer patients and older patients showed that 93% of them improved their pain level. And what was amazing was after 6 months, almost a fifth of them were able to stop using opioids or reduce their dose. So there is potential there for certain patients where medical cannabis can be considered, can be helpful in the right situation. But I was going to say in my group visit, when I talk about cannabis, I talk a lot about endocannabinoids that are in food. So, chocolate, saffron, carrots, these all have natural cannabinoid in them too. So you don't have to take medical cannabis. Again, another plug for plant forward foods. And I think at the very end here, if I can keep going, almost done, is this matter of mindset, which is super, super important. Okay, so I always tell my patients, it's not just what we choose to do. It's not just, for example, the surgery or the chemo or the radiation or the immunotherapy or whatever we decide to do, or the diet. What our mindset around that is just as important. What you do, what you think about what you're doing matters. Now, I'm not just saying this. There are studies showing this. So Ali Crum at Stanford has done a lot of studies on mind over milkshake, on mindset. And I often call this the mind over milkshake study that was done. This was not in cancer patients, but they were looking at how, they basically gave people a shake, and one group thought it was the same shake, but one thought it was like a sensible shake, and one thought it was indulgent shake, right? And depending on what they thought it was, when they measured the hormone levels, the hunger, ghrelin, leptin, that affected the release of the hormones. So our perception over things matters. Now, she's also done studies over mindset over exercise. Super, super interesting study looking at hotel workers and whether their mindset over what they did, their daily their job, and whether that was helpful for their health. So their mindset also affected their health outcome. That was very, very interesting. But what I really want to emphasize today is now they're doing it's this whole field of psycho neuro-oncology, where they're looking at mindset over in oncology. And this it's Ali Crum, but also Lydia Shapiro. I had the privilege of speaking with her at a symposium. She's an oncologist at Stanford, and they're looking again at the effect of mindset for cancer patients. And this was a study that they looked at, looking at how we view cancer. Is cancer, rather than cancer being catastrophe, it can be an opportunity. Rather than thinking about the body, like fighting against the body, we talk about how the body is capable. And so mindset interventions are very, very important. And again, that's why I think it's so important, back to the patient-provider relationship being so important, and the idea of team members and working on mindset, very important. And so this is again, this is where I practice. These are the tools in our toolbox. We have a number of group visits that we offer. This is the one I told you about today, was mostly about cancer survivorship, but I also do one on narrative medicine and brain health and bone health and metabolic health. So this is kind of a summary of the different weeks that we cover in our Living Well with and After Cancer. These are our yoga and group visits. These are some of the demos that I do. This is a edamame guacamole, which I like because it doesn't turn color. It doesn't oxidize, and the energy bites. I do a free shop with a doc grocery tour I started out for my cancer patients, but now I open it to anyone, and I just go through and love talking about the benefits of the different vegetables in the different markets. I've done one at an Asian market and also at a Indian market. And I start a walk with a doc for our patients as well. anyone in New York City, actually. So this is our place. I'm going to stop. I guess I should stop my share. And I'm sorry I went way over.
No, please don't be sorry. That was such an interesting talk. And I took some notes and I need to watch it again to glean all the information. But we do have some questions and people would love to have them answered. But I'm curious, Dr. Loy, who is your typical patient? I mean, do you see a lot of cancer patients? Because I know you're like quadruple board certified. And I think one of your certifications other than integrative and lifestyle is actually pediatrics, right?
So I see both. Yeah, I see probably about at least 50 of my patients are cancer patients, maybe even more, 50, 60%. But
Wow.
yeah, I
I
see it. Yeah, yeah. Probably about, yeah. So I see adult and kids. But yeah, most of
e-
my patients are adult.
even children with cancer or mostly adults with cancer?
Mostly adult with cancer. I've seen a few with a few children, but most of the referrals I get is for adults.
That's amazing. I know when I was first diagnosed, it took a year and a half to get an oncologist. So I went to an integrative doctor, and boy, the tools in their toolkit are amazing. And I'm thinking, why wait till you have cancer to see an integrative doctor? I mean,
Right, right.
well, because pretty much everything you recommended when I was seeing the list, things like acupuncture and yoga and meditation, those could be good for everyone, even without a disease.
Yes, 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 yes. Yeah,
It just
so
seems
we get consultations from all the different departments, not just oncology, but today this was our topic, so that's why yeah.
right. Well, but that's what I'm saying. Don't wait till you're sick, guys. Do these modalities now. They can be life-saving and life-changing, especially acupuncture. Boy, I mean, I love that. So you probably had to get a separate specialty for that, right?
Yeah, yeah, I did. Yeah, I did training in that. Yeah, yeah, it's
Yeah,
student state.
yeah.
Yeah,
That is so. I mean, I feel like I get the deepest nap when I get it.
that's what we call it, Shabrija. We call it AccuNap.
Because I don't know what it is. It doesn't even matter. Because one time I usually do it like later in the day, and I figure, oh, I'm tired anyway. One day he could only see me in the morning. I'm like, I don't want to come in the morning. I just woke up, but you know,
Yeah,
I don't know what happens when they put the
the
needle.
amazing. Yeah, but the amazing thing is that it doesn't matter when you have it. That night, you often the depth of sleep is always better. You know. So
Yeah.
I'm glad you have one. Yeah,
Oh, I
acupuncture.
love it. And then he's in the integrative, works with the integrative doctor in the Holistic Health and Healing Center. Let me get to some of the questions from the viewers, though. Can you talk a little bit about green tea? Because Colleen said many of the people that have come on the show, especially during Thriving in the Face of Cancer Month, talked about drinking green tea. The pharmacist and her oncologist told her not to take green tea capsules. She's going through cancer treatment. Do you have any thoughts on green tea or green tea capsules?
Okay, this is a very, very good question. Very good question that comes up a lot. So yes, there is good data on some data on benefits of green tea, right? As tea. Um, but there's there are some studies that show, especially green tea supplements above a certain amount, have been in some cases associated with liver elevations in liver function tests. And so I usually do not recommend green tea supplements in general. I sound like a broken record, and I think my patients know this, but I say food first. Take it in food form. Don't take it in supplement because it's most of the data when you look at the supplement form, it doesn't pan out. Same with soy, right? That's why I would say eat it in its whole form. So, and then the other thing is, when you're going through treatment, her oncologist is right. You have to be careful. You have to be very careful with any kind of supplements. And most of the time, I'm spending a lot of time and energy taking people off supplements because they just shouldn't be on it. Yeah.
Right.
So, oh, and the other thing I would say is if you're drinking a lot of green tea, I generally recommend that you don't drink on an empty stomach as well. Yeah, for the same potential reason for, that.
I found that, and I bought the decaffeinated one once, and it still gave me an upset stomach. Is the decaffeinated still good for whatever green tea does?
Yes, for the health. Yes, it's not the caffeine that's doing it. It's the EGCG, the epigalactin catechin gallate, whatever that thing. That is what's beneficial. Green tea also has L-theanine in it, which is what I call meditation in a bottle, and it gives you that. That's why when you drink green tea, some people say it makes them feel like it doesn't give them that jolt that they get from coffee, you know. part of the reason why is because it has the L-theanine, and part of it is because it has less caffeine.
Right. Thank
Oh,
you.
that answers Colleen's question.
Great. And there's a question from CN. We get this a lot. And Dr. Barnard's been on the show a few times talking about this. Can soy cause man boobs and other female stuff in men?
Yeah, that's a good question as well. So there was that they're concerned that it would increase um, cause that, but we have not. That is a we have not been seeing that unless you're taking huge amounts of like it's. I guess it's a theoretical concern. But again, if you're taking it in food form in normal amounts, that should not do that. And again, remember the way that phytoestrogens work is different from other estrogens, right? We know that the way it affects the alpha and beta receptors. It's so the way I explain to patients is that when the phytoestrogens in soy bind to the receptors, they act more like a tamoxifen aromatase inhibitor, like they act as a parked car. They sit there so the stronger estrogens don't bind. So it's not the same as a regular estrogen. Plant estrogens are good.
Great. Thank you. Thank you. What about people that are allergic to soy, though? Is there something that's almost as good that they could be taking?
Yeah, that's a good question. I mean, yeah, so it does, you don't have to just do soy. I mean, there are other look, any kind of bean or legume. I'm a big fan of beans and legumes. So, do chickpea or something else. It doesn't have, there's nothing specific about soy, right? Because some people just have an insensitivity to it. They just don't tolerate it. So, yeah.
Great. Thank you.
Yeah.
Candace said, you mentioned some clean skin care. What website was that?
Oh, it was called EWG, Environmental Working Group.
Oh, sure. Yeah.
Yeah, but
Okay.
they have, if you look up there, they have a whole section. I just don't remember the name right now, but just look up EWG, like beauty. It's a wonderful website. Yeah.
I have some great recommendations for clean skincare. I just got some. It's called Kaylin Harwell. It's vegan. She's vegan. Oh my God. It's soft as a peach. I even have a discount. I wasn't going to talk about this, but the box was sitting right here. And there's a few companies, Body Deli, that I love. So I'm happy to share that resource with people.
Your skin looks great, so whatever you're
Thanks.
doing.
Yeah. And I'm not wearing makeup today except for a lip gloss because I got a late start, but thank you. So my plant-based life this is a really good question because you had mentioned a lot of things that we can do that would be helpful. And plant-based life asks for somebody on a small income. So what treatment should be prioritized?
That's a good question. Well, I think of food as a treatment. So to me, a plant-forward diet is the way to go. And people think to eat that way is really expensive, but no, you can get bulk organic beans and legumes and all those things, right? And even I do want to get this out there. Even though, if it's possible, we prioritize like organic vegetables and fruits, but if it's a question of eating a fruit or vegetable or not, hands down, just eat the fruit and vegetable. Don't worry about the organic part, right? So diet first, I would say. And then, I mean, I feel like a lot of these things don't require money, like exercise, right? A lot of the mind body interventions, you can get a lot of that free online, right? So that's free. Um, what else? Even a lot of the yoga, these kinds of things you can get for free. So, I mean, acupuncture is covered by insurance for some people, but if it's not, that can be an additional expense. But I do refer, like, for some, I will recommend my patients to go, if you have in our city, we have a, a school for like, it's called Pacific College of Acupuncture. So they provide like free acupuncture, low cost acupuncture that their students will do under the guidance of their, of a trainer. And so people can get free acupuncture there too. So I will sometimes send patients to like a, free acupuncture clinic.
Right. And I've heard that there's places that do group acupuncture, so it's
Yes,
even less expensive.
we do that too as well. Group
Yeah,
acupuncture.
you just kind of go from patient to patient and
Yeah.
Be like the Pokemon. That's fantastic.
Yeah.
Okay. When I put the name of the skincare you mentioned in the show notes, I think I'd rather do a show about that and show you guys that. But I could. It's Kaylin Harwell. I've done episodes with her before. Well, you are just a wealth of information, Dr. Loy. Can people see you if they live in New
Yeah.
York? I'm guessing you don't
New
do
New
virtual.
York, New Jersey, Connecticut, and soon Florida. That's just where my licensure is. Yeah.
Right. Do you do virtual appointments or
Yes,
just
we
in
do.
person?
We do virtual. I do in person and virtual. Yeah.
That's fantastic. Well, thank you so much. And you have different, you don't do a lot of social media, do you, for people if they want to follow you?
I don't really own it because I just don't have much time.
Yeah.
But yeah,
Okay.
just LinkedIn and yeah.
Okay. Yeah. I'm not on there, so I couldn't even like look at
Oh,
your
okay.
stuff.
Yeah,
But
LinkedIn proximity. Yeah, those are my main ones. But yeah.
that's okay. We know you're busy. Well, just for fun, can I ask you just a fun question? Because I know you have kids and I know you love to cook. And so people love to know what the guests on this show, what you eat in a day and what you do for exercise. But how do you have
Okay.
time? You don't you have like five
I have
kids?
5 kids. Yeah.
So how do
So
you even have time to go to work?
well, my favorite exercise is I call my like trifecta. So only in the summertime when we have access to outdoor pool, I'll swim. But the rest of the time, I like to run. Well, my kids say it's a slow jog. It's barely a trot, but I like to let's call it run and yoga. Those are my favorite exercise things. And then oh, I love eating. Yeah, I make a lot of lentil bread. I love roast vegetables, soups. What else? Popcorn.
Popcorn. Oh, that's an interesting one. That's what
What else?
that's it's funny. The vet, our dog gained a little bit of weight, and the vet said when she begs, give her popcorn.
Yeah. I love popcorn with my homemade sauerkraut. It tastes really good.
But how do you eat it? Isn't it like how do you eat it
I
with
know it's soggy, so I just kind of mix it up, kind of
that?
like
That's so unusual.
I
Yeah,
know it's kind of good.
that's
So
fun.
yeah,
Well, thank you so much. It was so nice meeting you.
it was a pleasure.
Do you ever speak at any conferences like Plantrition
I
or any?
do. I speak in a lot of different conferences, yeah, around the country. I do,
Yeah.
yeah.
I just
Yeah.
haven't, our paths haven't crossed yet. Maybe you'll be a Plantrician next year.
Oh, maybe. Yeah.
Oh,
Yeah.
terrific. Thank you so much, Dr.
Thank
Loy.
you. Take care.
My pleasure.
Bye.
Oh, wait. I got one more question. I forgot. Oh my gosh. Because we got so interested in talking to you. Everybody gets the same question during this month. What message of hope would you currently share with someone? What would you share with someone currently facing a cancer diagnosis? I can't believe I forgot the most important question of the month.
Oh,
I should have told you in advance I was going to ask that.
oh, I'm not good thinking on my toes, remember?
Okay. Well,
Oh,
I'm sure you've seen people that have recovered or gone into remission.
yeah.
So, you know,
I would say, I would say mindset is super important. Having a positive mindset. For all the different patients I've seen, that really, really, really is important. So having a positive outlook, connection, I think that's super important. Having a positive outlook and a good team. Um, yeah. And I don't
that
just mean the medical team, I mean like, social connection, family, friends. Yeah.
absolutely. Thanks so much, Dr. Loy.
You're welcome.
And thanks all of you for watching day 28 of Thriving in the Face of Cancer. We want you to know that wherever you are in your cancer journey, we believe that there's still hope. Forgot to put my bracelets on today. Sorry about that. And as long as you're still breathing, you too can thrive even in the face of cancer. Please tune in tomorrow at 10 a.m. Pacific time for day 29 of Thriving in the Face of Cancer. My guest is Francis Spruitt. He is a 17-year lung cancer survivor. Isn't it great when you hear success stories like that, Dr. Loy?
I love it. Love
Yeah,
it.
that's my favorite thing. All right.